Okay.
I can hear you.
Perfect. We're going to give it just a few more minutes to make sure we give everyone a chance to get on. So give it one more minute. All right, Luann, do we have Miss Wright on?
Actually, we're both here.
Okay, she didn't show up, so you're good to go.
Okay. We had to go down to one computer because we were getting such a feedback on it before.
Yeah, I wondered what that was.
Sorry.
Okay, so we're going to go ahead and get started. Thank you all for joining us today. And if you don't mind, I keep forgetting to say this, mute your phone or your computer if you are not talking. So the last few months have been challenging to say the least, as we have all been impacted by COVID-19, and manufacturing is a huge asset to Davie County, and we truly appreciate everything you do for us and our community, and this webinar is obviously tailored just for you. To ensure the safety of our community and to help you navigate this new normal, we have created a Smart Restart Davie County guide, which will be shown today. This is a comprehensive guidance that includes many of the recommendations developed by Davie County Health and Human Services, along with guidelines from the CDC and other federal, state, and local agencies. This resource is going to act as a living document, which means it will be updated as often as the governor's new rules come out. The document can be found on the Chamber's website at daviechamber.com. So again, our session today will only be about 30 minutes. We will leave room for you to ask questions, and we encourage you to do so. And again, also this webinar will be recorded and sent to you. So we'll go ahead and get started. We are thrilled to have with us the Director of Davie County Health and Human Services, Ms. Suzanne Wright, and Public Health Nurse and Communicable Disease for Davie County, Ms. Luann Angel. So thank you, ladies, for being on, and I will pass the torch on to you, Suzanne.
It's Luann here, and thank you from Suzanne and myself for allowing us to be a part of this, and for the wonderful job that you did on the Smart Restart in Davie Playbook to assist our businesses here in the county. And I want to thank everyone on the call for your participation, and most importantly for the sacrifices that you all have made to protect you and your families, your employees, your customers, and the residents of Davie County. Those sacrifices have been enormous, and we appreciate it. We appreciate the diligence and cooperation that you've given in following the guidance and dealing with the executive orders. We know that you're anxious to, if your business had to be closed, if you were closed, to reopen, and if you were running at a scale back, to be able to get back to full force in your work. And we hope today's discussion will benefit you as you prepare to safely do that. The pages that we're going to look at, and Caroline has those posted, are 44 and 45 in the playbook, and it covers manufacturing. But I also want to refer you to pages 4 through 13. There's important safety recommendations, tips for communicating with your team, preparing your space, cleaning, and personal protective equipment that applies to all businesses. The specific section is what we're going to cover or talk about today. To begin, I would like to possibly ask who on the call has continued their operations or have scaled back their operations or curtailed their operations during this time.
everybody's quiet.
Okay. Some
Breakbush
things,
Brothers has.
and who am I speaking with from Breakbush?
This is Bobby Joe.
Hi, Bobby Joe. We had spoken before. You guys are doing a really good job. I may not be able to give you information that you're not already doing. But in your types of businesses in manufacturing, your work may require direct physical contact between your employees, but less or direct contact to your customers. Something to think about initially is the health of your employees. Employees who have a fever or otherwise exhibiting symptoms of COVID-19 should not be allowed to work. Make sure your employees are informed of your sick policies and stick to them. If an employee becomes ill during their shift, do not allow them to continue working. Something to consider: when we first learned about COVID-19 and started dealing with it, CDC gave the symptoms as fever, cough, difficulty breathing, or shortness of breath. They have since updated the symptom list to include headache, sore throat, muscle aches and pains, and GI symptoms such as nausea, vomiting, and diarrhea. We have had cases who have not had any symptoms at all but tested positive. They were tested because they were a contact or had traveled. So it's not everybody exhibits symptoms the same way. Signs should be posted at your entrances that individuals who have a fever, cough, shortness of breath, or other COVID-19 symptoms should not enter your buildings. There are some printable signs available on the CDC website, and also encouraging your workers to report safety or health concerns to you, the employer. Providing stations encouraging frequent hand washing. We should wash our hands often with soap and water for at least 20 seconds. If soap and water are not available, a 60% or greater alcohol-based hand sanitizer can be used per CDC guidance. A big thing to remind everyone, and you can post signs, there's signs on CDC about avoiding touching your eyes, nose, mouth, and face with unwashed hands. And if you do touch, then wash your hands afterwards. Many of you we have spoken with, and you have established on-site health screening strategies with checkpoints, particularly when your employees enter the facility. And these should include taking temperatures and symptom checklists. If you're not going through the symptoms, there are some checklist guidance documents, forms that you can use or modify on the North Carolina DHHS.gov/coronavirus website. Businesses of your type should establish isolation protocols in case an employee contracts COVID-19 and contaminates your facility or an area in your facility. Those areas that are contaminated should be closed off for deep cleaning. An important thing to remember is informing your employees of your situation and your mitigation plans. We have received frequent calls to our COVID call center from employees and family members of employees who are upset, and they feel like their employer is not being upfront, or they don't feel comfortable discussing their fears with supervisors, safety officers, or human resources. We know that if you have an ill employee, there's some confidentiality that you have to maintain, but if you shut down an area, giving them as much information as you can helps to stop and quelch that rumor mill. I think a lot of what we get in the call center has been exaggerated numbers and that type of thing for certain businesses. We always have that problem no matter what we're dealing with in communicable disease. It's important to establish a social distancing strategy based on the layout and the workflow of your facility. And that includes common areas like break areas. Strive for the 6 feet apart rule if at all possible. I know sometimes that can't be done. If there's on a manufacturing line, there may be closer together within just a couple of feet. If there's a way to place a barrier between those employees or screen could be installed, that would be really helpful as well. Arranging staggered shifts or staggering meeting times to allow for social distancing between employees is another thing you can do. One thing that we thought, in addition to the guidance that's in the playbook, is considering other options to clock in and clock out. Some of those procedures involve them touching common surfaces, swiping badges, that every person that goes through is going to do the same thing. So it involves common touch points for employees. If you could do a different type of check-in and check-out, whether it's a person signing them and, you know, checking them off in and out, or if there's someone cleaning those areas as that process is going on. And speaking of cleaning, disinfecting and cleaning is key. It's important to establish an adequate supply of those materials, as well as what you need to do your symptom screening, thermometers, that type of thing. It's important to establish a disinfection team to clean and disinfect an entire facility on a recurring basis. I know some manufacturing plants they work a shift and then the next shift is the cleaning crew comes in, or they continue to run their shifts but have time in between for a cleaning crew to clean. And we can't say that enough, especially in the type of close work that you all have to do sometimes. The frequent cleaning of touch common surfaces in common areas like vending machines, microwaves, coffee pots, etc., should be cleaned between use. And thinking about the materials that you receive in to your facility is one thing. Establishing an inbound parts, materials, or packages disinfection strategy is helpful. And expediting shipments received should be handled usually. If you've got something that you can't let it sit dormant for up to 48 hours, it's important to the person who's handling that material that comes in uses the proper PPE and personal sanitation practices. Shipments, things coming in, can be sanitized by an appropriately trained person with a 10% bleach solution or a hospital grade disinfectant, but making sure that they're trained in handling that cleaning material, whatever it is. And as I said earlier, whenever possible, allow those incoming materials to sit untouched for 48 hours from the time they're received, if that's at all possible. Sometimes that's not even doable. And then in your type of setting, to have an internal pandemic response team who, and a lot of you have already done this, who have designed and implemented things like a return to work plan. If you have an employee who becomes ill or tests positive with COVID-19, not just their return to work, but planning out how long you're going to shut down for cleaning, how you're going to bring your employees back in, if you're going to change any screening or any staggering of shifts. Those are all things that's important to think about ahead of time. And assigning a COVID-19 protocol and training strategy. Training goes along with keeping your employees informed of your situation, and what you're doing for mitigation really does help. That was a lot of information very quickly. Now I would like to hear from you guys with any questions, or if you want to share any best practices, things that have worked well in your facility. And just remember to unmute your mic.
Bobby Joe, let's start with you. What are some things that you guys are doing at your facility?
Can you say that one more time?
Yeah, what are some of the things that y'all are doing that you feel like you're kind of knocking it out of the park? Because it wasn't an overnight thing, right? This has taken a lot of time, but what are some things that y'all are just knocking out of the park, you feel like?
I think that we're doing a really good job with sanitation, because we have a sanitation department that cleans for at least 8 hours every night. And so we've already had, great chemicals. I think that really put us ahead of the game because we already, as food manufacturing, our employees already wash their hands for 20 seconds. We have sanitizer all over the place. So I think that's the thing we're definitely knocking out of the park.
Are there any challenges that you're facing right now?
Well, I'm having a challenge with this mask wearing thing, but you know, it just doesn't seem to work really well. We have a refrigerated environment, and so we're having issues with when you breathe in and out of a mask all day, that the mask starts getting wet by the end of the day just from your breathing and being in a refrigerator. So that's the one challenge that we're facing, but we're trying to power through it. So I guess we're just going to have to bring extra masks, and so I've had like 2 masks today. That's kind of our challenge right now.
Got it. Gino, what are you guys doing really well, and what's one of the struggles that you're facing, or do you have any questions?
I think we're doing a great job. You know, part of what we're doing is we're instilling a deeper cleaning on Fridays. We run Monday through Thursday, so it gives us more time to really spend and go into the nooks and crannies. You know, we're the distancing. Our business is a little different than everybody else's. We're fairly far apart. You know, I guess I'm fortunate to have somebody from the medical industry that has joined us and has helped out putting a lot of these things in place fairly quickly.
That's awesome. Great job. Do you guys have any questions?
No.
Okay. All right. So, Luann, do you want to wrap it up as far as them being able to contact you? I think they probably already know the drill, but since this is being recorded, for people to get in touch with you and all that kind of fun stuff.
Certainly, I will do that. But one other thing beforehand is thinking about if you have employees who test positive for COVID-19, the isolation period is 10 days for us as a medical facility, is 10 days from their symptom onset and at least 3 days with no fever medications on board. I know a lot of companies require the 2 weeks. Another thing to think about also is if you have an employee and they have a household member who is positive for COVID, then the recommendation is that household contact, your employee, needs to quarantine themselves at home for 14 days, for 2 weeks. That incubation period is up to 14 days. You know, thinking about how you're going to be the flexibility that you can offer your employees for that. I know a lot of people are concerned if they're not the sick person, they're concerned about being out of work and that type of thing. So just, talking to your employees up front about things is great. That is very, very helpful to relieve their concerns and fears. We can be reached in the COVID call center every day, Monday through Friday, 8:30 to 5 at 336-753-6550. If you should need to call after hours or on the weekend, that phone actually rolls over to the nurse on call. So you will be able to have someone call you back. And we welcome your calls with questions or concerns at any time. And thank you for your participation today.
All right. All right, so that's the end of this session. Thank you guys for joining us. Again, feel free to reach out to Davie County Health and Human Services in the Chamber at any time, and we hope you have a fabulous day, and this is the end of our call.
Thank you, Carolyn.
Thank you.
Thank you.